In this video, you will learn exactly how to get rid of lower back pain fast at home. Back pain is one of the most common physical ailments. Studies show that 8 in 10 Americans have back pain at some point in their lives, usually in the lower back. You might have sprained it while working in the yard or cleaning house. Or your back might hurt from an old sports injury or a chronic condition such as arthritis or ankylosing spondylitis. Sudden or severe back pain should be checked by a doctor or a physical therapist. That also goes for pain that won't go away. But sometimes you can treat nagging pain and a discomfort on your own. Here are 6 different ways that can help getting rid of your lower back pain fast at home. 1. Exercise. You should do light exercise to minimize your lower back pain. In my experience, it does help reduce the pain if you exercise a few minutes every morning. The muscles in your abs and back play a critical role in supporting your lower spine. These muscles don't get a good workout during the course of a normal day. They need to be specifically targeted through exercise. There are many simple exercises that can be performed in 20 to 30 minutes as part of your daily routine. If you are just starting out, even the simple act of sitting upright on an exercise ball for 30 minutes a day will engage your core muscles. You might not feel like it when you're in pain, but this is probably the first thing your doctor will recommend. A common misconception in patients with isolated back pain is that they can't stay active. Try to keep up with your usual level of daily activity and movement. It can be a brisk 30-minute walk or circling the block with your dog. Aim to get on your feet at least 3 times a week. Being sedentary allows the muscles around the spine and in the back to become weak, says Salman Hamani, MD, an assistant professor of orthopedics at Emory University School of Medicine in Atlanta. That in turn can cause less support for the spine and lead to long-term pain. 2. Use hot/cold treatments. You may have heard that one is better than the other for relief from back pain. The short answer is that the best option is whichever works for you. Some people come in and they swear by heat or ice. You might want to try both, and you'll probably find that one is better suited for your relief. Usually, ice is best if your back is bothered by swelling or inflammation. A heating pad may be better if you're trying to relax stiff or tight muscles. Limiting ice or heat treatment to 20 minutes at a time. And don't use them if you're also putting muscle ache creams or ointments on your skin. Another effective method is hot and/or cold therapy. This remedy is easy to implement, and it's also an inexpensive option. Certain varieties of aches might be alleviated with the application of heat and/or cold. This may include lower back pain stemming from common causes, such as spinal stenosis. If you have sustained direct lower back pain from an injury such as a collision, a fall, or a sports injury, hot or cold therapy could be a solution. Other kinds of aches that may be minimized from hot or cold applications include sore muscles from exercise, as well as a pulled muscle that results from straining the back. Regular applications of ice to the painful areas on your back may help reduce pain and inflammation from an injury. Try this several times a day for up to 20 minutes each time. Wrap the ice pack in a thin towel to protect your skin. After a few days, switch to heat. Apply a heating pad or warm pack to help relax your muscles and increase blood flowing to the affected area. You also can try warm baths to help with relaxation. To avoid burns and tissue damage, never sleep on a heating pad. 3. Stretch more. Grandma was right. Slouching is bad for you. And poor posture can make back pain worse, especially if you sit for long periods. Don't slump over your keyboard. Sit upright, with your shoulders relaxed and your body supported against the back of your chair. Try putting a pillow or a rolled towel between your lower back and your seat. Keep your feet flat on the floor. One often overlooked contributor to lower back pain is tight hamstrings. If your hamstring muscles, located in the back of your thighs, are too tight hamstrings, your lower back and sacroiliac joints will be stressed, leading to more pain. Hamstring stretching should be done carefully and at least twice per day for 15 to 30 seconds each time. There are many gentle stretching exercises that should not hurt. Strong muscles, especially in your abdominal core, help support your back. Strength and flexibility may help both relieve your pain and prevent it. A lot of times, I encourage people to do that first thing in the morning, Ray says. But if you're older or worried about overdoing it, You can stretch and do your strengthening exercises later in the day when your body is warmed up. Yoga, Pilates, and Tai Chi are just a few of the ways to strengthen your core and the muscles around your hips. One exercise that targets your entire upper and lower back is to lie on your tummy and lift up your legs and arms in the flying position. 4. Get better shoes. The shoes you wear can certainly have an impact on the health of your back and may actually be one of the best and most obvious lower back pain remedies. High heels are known to contribute to problems in many people. However, simply wearing flat shoes is not necessarily the answer. Appropriate arch support and cushioning of the foot is vital, and doing so may significantly aid in pain management. The way that your shoes fit is another important factor. If they are too tight, resulting in foot pain may cause you to change the way you walk, and that can lead to stress on the back. Similarly, wearing shoes that are too big can cause you to compensate by changing your gait. Getting orthotic insoles is one way to maximize proper mobility and comfort and get rid of back pain. This helps ease the pressure on your lower back. You can use tape, straps, or stretchy bands to help keep your spine in alignment. Aim to keep your head centered over your pelvis. Don't slouch your shoulders or crane your chin forward. If you work in front of a screen, rest your arms evenly on the table or desk, and keep your eyes level with the top of the screen. Get up from your chair and stretch and walk regularly. 5. Reduce your stress. Ongoing back pain can wreak havoc on your life, affecting your cherished relationships, finances, and your ability to get stuff done at work and at home. Finding activities that make you happy can help reduce some stress and may relieve some pain. Some people find that even doing just 3 things that make them feel good each day, such as enjoying a comforting cup of tea or coffee, calling an old friend, walking the dog, or receiving a longest 30-second hug from a loved one, can make pain more tolerable. Even something as simple as laughter with a friend may stimulate feel-good endorphins. 6. Get better sleep. When you have back pain, sleeping can be hard. It can be a vicious cycle because when you don't get enough sleep, your back pain may feel worse. A poor sleep position can also aggravate back pain. Try lying on your side. Place a pillow between your knees to keep your spine in a neutral position and relieve strain on your back. If you need to sleep on your back, slide a pillow under your knees. Be sure to sleep on a comfortably firm mattress. Pain is a leading cause of insomnia, difficulty with falling asleep and/or staying asleep. Inadequate sleep can also make your back pain worse. This vicious cycle makes it more difficult for you to get restorative sleep. Getting enough restorative sleep is needed for the body's tissues to heal and recharge energy levels. If you have trouble sleeping, it is important to address pain or other factors that are causing it. Your doctor might recommend lifestyle changes, medications, or other treatments depending on what is disrupting your sleep. A rolled-up towel can be a handy tool for back pain relief. Try putting it under your pelvis when you're lying down. Let your hips relax over the towel and help stretch out the tension in your lower back. A back brace can sometimes help, especially after an injury or surgery. But they're not meant to be worn too often or for too long. People become dependent on it, and it actually allows those muscles to become lazy, Ray says. No matter which home treatment you try, Hamani says, if it helps you, if it makes you feel better, keep doing it. If you often commute to work using your car, you also want to check out this video on how to get rid of neck pain from driving.